With respect to the microbiome, what is our current understanding?
The microbiome is its own universe, right? It's like, what do we mean by the microbiome? That's like plumbing the depths of the ocean, or plumbing consciousness, or plumbing, the cosmos. I mean, it's a whole universe in there.
Will doctors be as relevant, let's say 5, 10 years from now? Would that shift? What does it mean for gastroenterology?
I think AI is going to demand of doctors to be the best doctors they possibly can be. It's not going to be who knows the most anymore, because the AI will know more than us always. It's going to be about who's the best communicator. Can we do better than the computers? Can we be more empathic than the computers? Can we do a better physical examination? Actually lay hands on and do, exams? Can we look people in the eyes in a way that still leverages the human touch? Can we do procedures that robots don't yet do? Now, again, every one of these things might be replaceable. But until that time, it's going to force us to be the best versions of ourselves that we can possibly be.
Dr. Brennan Spiegel, a very, very warm welcome to the Scope Forward show. And once again, you are the professor of medicine at public health and chair of digital health ethics at Cedars-Sinai, also the author of VRX. And the last time we spoke, it was after the publication of your book. So I'm really happy to chat with you again.
Yeah, well, it's good to be back. Thank you for having me.
So, Brennan, I want to roll back the clock back to the time when VRX was published. And you shared a whole bunch of things about extended reality and about your research. So, please get us up to speed with what has happened since then and what have your discoveries been in terms of research and everything else that's been happening.
Sure. Well, the book VRX was really about virtual reality, but it's about more than that. It's about the intersection between technology, human psychology, clinical medicine, neurology, and even philosophy of mind and consciousness itself. And it was a sort of philosophical journey through what it means to use simulations to modify human health. And that's what VR does. When most people think of virtual reality, they think of a platform for gaming and entertainment. But we've been really looking at it through a different lens, as a technology that can help shape mind and body in a way that actually has physiological and measurable effects on the human body. So that's the direction that we've been going ever since I published the book, was really to explore more about this technology. How does it work? In whom does it work? And what is the best type of therapy and best type of condition to treat with these simulated worlds in virtual reality? And so we've done a lot of work since then looking at virtual reality for pain management. We now have a study also funded by the NIH looking at it for management of irritable bowel syndrome, or IBS. We have a specific 8-week IBS treatment program, and it uses virtual reality and artificial intelligence. So that's been another direction we've taken with the AI explosion and the large language models that we all now know how to use, is combining spatial computing and AI. And now, in addition, we've had incredible advances in the spatial computing technology with, for example, the Apple Vision Pro. So these are just some of the directions we've gone in to use AI and VR together to treat a whole wide variety of conditions, from IBS to helping patients with cirrhosis and liver transplant waiting lists maintain sobriety from alcohol use disorder, to post-bariatric surgery outcomes. We've been using it for urologic oncology. The list goes on and on with some of the applications.
Amazing. Any surprising insights, especially in the space of GI?
I don't even know if it's a surprise, but we all learn about the brain-gut axis in gastroenterology. That's a term that we use a lot, and we talk about it. But what does that really mean? And the surprise to me is how something like VR teaches us firsthand what that means. I've had patients with significant abdominal pain that hasn't, improved from traditional pharmacotherapies who will try VR, and next thing you know, the IBS is like improved. The pain gets better very quickly when it's effective. And when we look at the human body receiving VR, we now have a new study that demonstrates it can change cortisol levels in the body, it can change body temperature, it can even change the white blood cell count in the body over the course of 15 or 20 minutes. So this demonstrates so profoundly what, most spiritual traditions have known for hundreds, if not thousands of years, that the mind and body are interrelated. In a way, it's just one system, the mind and the body. And if you affect one, you affect the other. And so that's really the surprise, is just being able to measure that and see it. Something I never really thought I would be doing in medical school, now doing routinely in my clinic here at Cedars-Sinai.
I just want to unpack this a little bit, especially the gut brain axis. So, what do we know about it as far as Western medical science is concerned? What is the definition of the gut brain axis, and how far have we come in terms of our understanding the obviousness of it, as you say? But what do we know about it to begin with?
Firstly, it's probably better described as the gut-brain-microbiome axis. And in this view, the microbiome is an intermediary between the nervous system, central and peripheral, and the viscera. We're, of course, particularly interested in the GI tract as gastroenterologists, but same could apply to GU or cardiovascular viscera. But the microbiome clearly has a role when it comes to the gut. And we know that something like the vagus nerve, for example, is critical for communicating between the brain and the gut in partnership with the microbiome. And the amazing thing about the vagus nerve, there are many amazing things about it, but I think this is about right. For every one fiber going down, there's 10 fibers coming up. Is the tail wagging the dog or the dog wagging the tail? And so the microbiome puts off all sorts of metabolites, and it's very involved, for example, in producing serotonin as well, which we can talk about perhaps. And that will affect both motility, but also directly affect the nervous system, the nerves themselves, and the vagus itself. And if you stimulate the vagus, it might actually have effects down in the gut and back up in the brain. And so this is just one example of an accessible highway through vagus nerve stimulation, whether it's through the neck or the ear, to directly affect the brain and the gut. Cortisol, HPA axis, these are other mechanisms by which the brain and the gut interrelate and communicate. And there's so many other incredible discoveries from people like Emran Mayer at UCLA and so many others who are really demonstrating to us that this is one unified system that co-evolved in partnership with the microbiome. And that's really the key. So it's such an interesting point for me.
It's amazing. What part of this has reached mainstream GI?
Well, I think we all recognize now in GI that cognitive behavioral therapy and other forms of psychological therapy do benefit irritable bowel syndrome. And we've learned more about maybe how that's working. It's possible that cognitive behavioral therapy might actually affect the gut and the microbiome. And the microbiome and its diversity and its components might in fact affect the brain and how we respond to something like CBT. When we look at meta-analyses, we know that behavioral interventions are among the most effective from a number needed to treat standpoint compared to traditional pharmacotherapies that affect motility, let's say. That's not to say one is superior. It's really a holistic approach to understanding the brain-gut axis. And, virtual reality is just one example of a non-pharmacological, centrally acting psychotherapeutic that gives us an ability potentially to augment the traditional pharmacotherapy. So we have a study going on right now comparing a common medication, linaclotide, plus virtual reality in combination, compared to linaclotide monotherapy. And that's an example of a study where we can directly measure whether there's some synergy between both the brain and the gut if we hit both sides of it with different types of mechanisms of action.
Really exciting to hear all of this. Talking about the microbiome specifically, the startup world is full of it. I know as an academic researcher, you're very involved, and maybe there may be several others who might be involved in the research of the microbiome. But when you look at the broader GI industry, there's not much involvement. Physicians are not leading that. It's just mostly the startup community that seems to be leading it. Why is that? There's a disconnect here, especially when this is such an exciting space for GIs to discover and play a leading role.
I hadn't thought of it that way because I see a lot of traditional academics and universities actively studying microbiome research. I mean, there are incredible discoveries. For example, here at Cedars-Sinai, where I work, Dr. Mark Pimentel has done a lot of the foundational work here in a traditional academic environment, examining microbiome's relationship to brain-gut health. And that has translated into, a commercially successful product in the form of rifaximin or Xifaxan. I have no ties to it personally, but that's a really nice example where a traditional academic approach led to a commercially successful outcome. So, yeah, I guess I'd have to think more about if that's entirely accurate, that it's really in the hands of startup companies versus academics. But yeah, there's a lot also of kind of snake oil in this space. The microbiome is its own universe, right? It's like, what do we mean by the microbiome? That's like plumbing the depths of the ocean, or plumbing consciousness, or plumbing, the cosmos. I mean, it's a whole universe in there. And so it's not one thing. We're starting to just barely understand it. And I do think the future of health in part will be tied to understanding the microbiome and our individual relationship to it in ways that are still hard to even understand. But it's exciting to be at least thinking about it.
Even with respect to the microbiome, what is our current understanding? Different studies come out at different times and qualify how big or how vast the microbiome is with respect to human DNA. What is our current understanding?
Well, I mean, there's trillions of organisms. And DNA of the microbiome outstrips our own. We are carrying around an entire ecosystem within us in a way that is, coevolutionary. I have my own theories about where the microbiome came from and how it might even help us manage the force of gravity itself on this planet. We might talk about that. But what we do know is in health, the microbiome is diverse, and there's many different species that are in symbiotic balance, and they are the interface between us and the world. We have the exteroception, the parts, our skin, the outward parts, but then we have our inner part, which itself is still exposed to the world in terms of the food that we ingest. Microbiome is vital to that. If we have a problem, a breakdown in the microbiome, or if we don't feed it the right foods to cultivate its health, it will start to eat us. It will start to eat the mucus layer that protects us and break down our lining and lead to so-called leaky gut and allow this breakdown between us and the world around us. And that leads to autoimmune diseases, immune dysregulation, chronic abdominal pain, serotonin dysregulation. So that's sort of a 10,000-foot view of what we think is happening with the microbiome, but there's so much more that I don't even know about.
I mean, the way it can shape up is it can be a field unto itself if we know more and more about the microbiome. What kind of opportunities would it present to the GI field?
Hippocrates famously said, I think around 350 BC, I could have the dates wrong, that all disease begins in the gut. That's what he said. And there's some truth to that. If we really look at the gut as the origins of this entire, cosmopolitan inner world that we carry around with us, and if that world directly affects our health, everything from autoimmunity to gastrointestinal conditions, but also so many others and mental health issues, then now gastroenterology is not just about the gut at all. It never was. It was about total human health. And if we go a step further and look at something like serotonin, which is a vital, vital neurochemical, without which we would be a flaccid sack sitting on the ground, unable to get up like a baby just born. Okay. Without a microbiome, we wouldn't have that. And 90 to 95% of our serotonin comes from the gut. And that's mainly in partnership with the microbiome. And so, we can get into those details, but gastroenterology becomes far more than just a GI field. It's a whole body field. It's just thinking about our core, the gut itself, as the stepping off point for understanding human health and well-being.
Seems like the gut can become actually a gateway to whole different perspective of not just the human body, but everything that goes on inside. Like that'll be very interesting. And just simply from a business standpoint or from a technology standpoint, it opens up many, many opportunities that possibly we aren't even imagining or even seeing now. I could do the whole conversation on just this one thing, but there are other things that I'd love to cover. I've been a big fan of your writing, and when I read VRX, I was fascinated by the many, I'd say, hidden messages in there. Like, so it looked to me as a reader that there were topics that you were interested in, such as human consciousness, that were masked under the wrap of VR and dealing with a scientific book at the same time. There were certain topics that were beyond what science could grab and classify. Like, so I found it very, very interesting. But you have a new book coming up later this year, and it's called Pull, and it's got to do with gravity, as you were telling me. Please share more.
Yeah, thank you. Well, yeah, it's called Pull, Pull, and that's referring to the pull that we all feel of the earth itself upon our bodies. And long before we were here, long before the first unicellular organisms, gravity was here. And long after we're gone, I think it's a pretty good bet that gravity will still be here. So it stands to reason that every part of our body, every cell, every tendon, every sinew, every microtubule in our bodies evolved to manage this fundamental force of physics. Actually, there's only 4 forces in all of physics. One of them has to do with stars and nuclear fusion, and one of them has to do with our body not exploding. And once we have that kind of figured out, there's only 2 other forces we manage. One is gravity, and one is electromagnetism. And everything else emerges from that. So when we look at our bodies in relation to gravity, all of a sudden a lot of things come into view. For example, what is lower back pain, if not an obvious form of gravity intolerance? What is heart failure, if not gravity intolerance? The inability to pump those 5 liters of blood up to your brain and back down again. What is dizziness and vertigo, if not a form of gravity intolerance, where the inner ear, which is constantly keeping track of your relationship to the planet itself, is thrown off? But then we start looking at things like depression, feeling down, literally feeling down, and ecstasy, feeling up. What is this verticality of the language that we use? And what does that have to do with gravity? Why is it when you're on a roller coaster and you go down the drop, do you get these butterflies in your stomach? The same feeling that patients with irritable bowel syndrome get when they're not dropping on a roller coaster, or the same feeling somebody gets when they're scared and they get gut feelings. What is it about a gravity challenge that leads our bellies to ignite? Okay, these are all the questions that I wrestle with in this new book, Pull. And in it, I introduce what I call biogravitational medicine, which is a way to rethink how our bodies are an emergent phenomena of the physics of our planet. Physics came first, then chemistry, then biochemistry, then eventually anatomy and physiology, and then nervous systems, and then somewhere consciousness started to evolve, might have been there earlier, psychology, sociology, human civilizations. It's all built on physics, and physics itself on mathematics. So that's what this book is about. And in the end, it's not just a philosophical meditation. It's really about very pragmatic ways to live differently. And of course, the gut has a big part to do with this too. That's a little bit of an overview of this new book. Very excited. comes out in October.
Very fascinating and very, very different than any of the books on similar topics out there. I don't think there's anything like it specifically.
It's different. And what was so interesting to me is I originally wrote an article about irritable bowel syndrome being a problem with gravity management. It's one of the most widely read articles I've ever written. I've written over 300 articles, but that one ended up getting international media attention from everywhere from, India to New Zealand to you name it, all over the world. And then that really led me to think more about gravity. And then I realized that, there isn't a single book on this, but there's been people writing about this for centuries. I mean, inverted yoga positions is about changing your relationship to gravity, flotation therapies, tilt tables. Why does exercise and abdominal strengthening and back strengthening help so many conditions? How do we stand stronger and live longer? And there's an extensive literature on this. So all I've done is taken it all and kind of reformulated it into my own conception of human health in this new book.
One of my yoga teachers refers to this aspect that if the body is dropping towards gravity, then you're aging faster. So true. From that standpoint, your muscles are giving way.
Well, if you think about it, our goal in life after birth is to stand up and stay up as long as we can and as well as we can until eventually we're pulled back, physically at least, into the earth. And in some traditions, you end up in a grave, which poignantly is a word derived from the word gravity, or shares the same etymology. It's like a gravity box. That means we're back where we started. Now, some might argue that we rise too in our final breath, and you move up into the heavens, right? Away from the pull of gravity, you finally escape the bonds of its pull. And that's the ultimate ascension. This thought of ascension and descension is intrinsic to our language, intrinsic to our emotional states, and intrinsic to our biochemistry and our physiology.
How interesting. Very, very interesting. I read just a few minutes ago, actually, in your book description, that a family dinner inspired the book. What was that?
The story is my mother-in-law had been in a assisted living facility, and she started lying down all day in bed and was having more and more difficulty getting up and walking. And almost in lockstep with her spending time in bed, she started to develop abdominal bloating and discomfort and even some constipation. And since I'm a GI doctor, of course, my family asked me to, look into this. And I thought about it. She hadn't changed her diet, she hadn't changed medications, but all of a sudden she had all these GI issues. Well, we're not designed to lie flat in bed all the time. We're designed to stand up and to stay up and to move around. And that's because the gut is a functional stack. It's like a marionette on strings. When you dangle that marionette, it articulates, it animates. If those same strings are too stretchy, or if you just let the thing lie down, it doesn't animate anymore. At nighttime, when we're sleeping, our gut's asleep with us, but we get up and it gets up, and it becomes a functional stack with suspension systems that keep it up during the day. So it only stands to reason that if you're lying flat all day and this gut is pancaked upon itself, that it's going to start getting stagnant. It's not going to move. The microbiome is going to start overgrowing as a result. It's going to start creating gases. It's going to change serotonin physiology. You might get constipated. You might get bloated. You might get depressed. And it's literally because of your relationship with gravity. And we know this from hospitalized patients. We take the sickest patients in the world, the most vulnerable people in the world. We put them in a hospital bed where they lie flat for days and sometimes for weeks. And then we're perplexed why they have ileus or bowel paralysis, or they get blood clots on their legs, or they have breakdowns in their skin. We're not designed to lie like that. And that was the insight that caused me to think more, not just about the gut, but the entire human body and its relationship to gravity.
Have you also offered practical takeaways or insights on what people can do?
The whole end of the book is full of specific recommendations. There's also a self-assessment, so you can put yourself into one of 8 different biogravitational categories, and depending upon which of the 8 you meet, there are different recommendations, whether it's exercises or diet. Of course, you should always work with a doctor, but there are some very pragmatic things, including virtual reality, in fact. We find that VR, the elevating forms of virtual reality, are so empowering to patients, and that's what tends to cause their pain to fall away, is when they literally feel like they're ascending into the heavens, when they literally feel and look around and feel a sense of elevation, even though their body hasn't moved an inch. Their brain and the physics engine in their brain, and that's actually in an area called the anterior insula, fires off, and we have something called graviception, which is another sense that we don't talk about much. That's our perception of gravity itself. And we can simulate graviceptive experiences through mindful meditations, through imagination itself. And this can even help people with depression.
I'm looking forward to reading this book. It's very, very fascinating. I want to leave some time for us to talk about AI, frequently AI and human consciousness. Let's get started with AI. We met earlier this year at the AI and GI Summit, and it was interesting to see different perspectives on where GI is going as far as artificial intelligence is concerned. From what you know and your research, please get us up to speed on AI in general in healthcare and AI in GI specifically.
Jeffrey Hinton, who won the Nobel Prize for some of the discoveries of modern AI, has been quoted as acknowledging that healthcare is probably the most important use of AI. It's the most beneficent use, most impactful use. So AI is here, and those of us in healthcare must embrace it and must find ways to use it. Now, how to use it ethically, transparently, those are deep and important questions. Those are questions we're wrestling with in our research laboratory. We've been developing AI systems, for example, that can take an incredible history, that can interview a patient, even a patient with mental health distress. And we've been finding that some of our patients actually quite prefer to talk to this robot-like entity. We then can embed it within virtual reality environments, and all of a sudden, the world around you can be responsive to what it is that you're talking about and seeing and feeling. Music can be selected at just the right moment and the right time for somebody with depression. Next thing you know, you're in a Japanese rock garden doing a tailored meditation with 6 different forms of AI providing audiovisual support. And then on top of all of that, a system like that can literally write a note, clinical note, and put it in the chart. So we have patients now who get this AI system, and then it writes a note for us. We have patients who come to my clinic, the note's already written, and it's an amazing note. Now, of course, we have ambient scribes that can write notes for us in real time now. There's all sorts of machine vision systems that can interpret x-rays. I mean, the list of applications is endless now. But we have to figure out how to use artificial intelligence. And that's something that we've been actively pursuing. And it's been just an amazing early experience getting to understand these systems better.
What's the wildest experiment or insight that you've got in AI?
I don't know if it's the wildest, but it might even help bridge the discussion about consciousness, which I heard you might want to talk about, and what distinguishes humans from computers. So recently I had an experience where we had our AI system take a history from one of our patients. And so the patient, the way it works, speaks to a voice in the computer, and they talk back and forth. It's very empathic, very human-like, emotionally valenced conversation, and it wrote a note. And so I had access to the note before we went in to see this patient in their room in the hospital, and we read the note. And the note was very comprehensive, very thorough, very well constructed. But as I'm reading it, I thought to myself, this clinical pattern is not something I'd seen before. And I've seen a lot of patients. And I sat there with my students and we went through the story and we said, what could this possibly be? And we went to some of the most exotic diagnoses we could think of to try and explain this situation. Well, when I went in to finally see the patient, I noticed right away their body language. I noticed their eye contact. I noticed their eyes darting around. I noticed they had psychomotor activity, moving legs, very uncomfortable, shifting in bed. There was something about this patient that didn't feel right to me emotionally, like human to human. And I started asking him questions. And he indicated that he was a local student at a university, and I happen to teach at that university. So I asked him some questions about his experiences there, and it became increasingly clear to me that he might not actually be a student at that university. In fact, it became more clear to me that virtually everything that he was telling us, that he was telling the doctors, and in fact that he told the AI was made up, confabulated. The
Wow.
entire story was false. This was a profound situation that required psychiatric intervention, but the AI had no idea that it was being lied to. Had no idea. Maybe in the future it will know that, but it required a human talking to another human to figure out what was actually going on, and there was no way that that computer was going to be able to figure it out. Not yet, anyway.
That's very interesting. In applications beyond healthcare, AI is able to track eye movement, it's able to perceive very small changes in gestures, emotions. It's even able to rate the tone of your voice. When I use Read AI on Zoom, it's giving me all kinds of information that I don't need actually, like, on the emotional aspect of my meeting and whatnot. Like, so, which is all interesting. So, don't you think it'll get there eventually? You have a camera, you have variables. It just doesn't have the perceptive capability right now. But if you give it the data, it'll probably figure it out.
I think so. I think here's the hard part is we experience a spatial world. We have this unity effect where I can right now look at you and know that you're on a screen, which, by the way, is a virtual replication of you, itself code and binary showing me some interface that resembles you, but I'm imagining you there. I hear sounds from the street down there that's coming spatially into my ear in a direction that tells me that your sound's coming from there and the cars are coming from here. Light's hitting me in a certain way. Your mouth moves at a certain rate and words come out of it, and I can tell those words are coming from your mouth. And so I then somehow create a unified experience of all of this as one form of consciousness, as a streaming, continuous, multi-dimensional experience. Now, I don't yet know if AI will get to the point, maybe it will, where it will experience the world in that way, as opposed to a video, which is a two-dimensional pixelated, experience input and eye tracking. But it's not experiencing the world in the three-dimensional way we are.
Hmm.
I don't yet know if that has consequences for its capabilities or its ceiling compared to what we're able to do.
Yeah, we'll have to wait and watch because a whole bunch of robots and humanoid robots are on their way. And I saw some demos just this week. They're quite fascinating. So, combining AI capabilities with robotics, it's attaching sensors in a way, right? Like, so.
I mean, listen, it really does get at the core of what are we anyway?
Yeah.
And why aren't we computers? I mean, this is an age old philosophical question. Maybe not age old. We haven't always had computers, but it's age old in the sense that, you know, are we even just living in a simulation, right? I mean, get a little philosophical for a second. Are we just binary code anyway? Are we just code? The quantum world that gives rise to this deterministic experience that we have bears no resemblance to the world that we experience. So, yet even I don't know what I am, and I don't know what consciousness is. And as far as I can tell, nobody does. Nobody knows what consciousness really is. So, who's to say that we're not just tremendously efficient computer systems that are living in a computer system of sorts, and that's the universe itself. All right, so we get very philosophical here, but what AI is demanding of us is to ask these questions anew. The questions I wrestled with as a philosophy major in undergrad are all of a sudden coming back up again in force. People are wrestling with them as if they're new questions, by the way, but they're not new at all. I mean, Plato was asking this question when he did this thought experiment of the cave, where these men were in a cave and all they saw were shadows on a wall of objects that were actually being projected from behind them, behind the sun, and they didn't realize there was a world behind them. They just experienced that cave. And so these are not new ideas. But boy, these technologies are demanding that we try to wrestle with these questions like we never have before, because we might be facing an existential future. I don't yet know what we're dealing with right now.
So it's very interesting, Brennan, because I've arrived at a very similar point, and in my own journey, there was a time where I would keep this aspect of me separate from the science aspect or the technology aspect of things. The way AI has developed and the way it's doing certain things and the way it knows, and this is beyond, it seems to be beyond just data and pattern recognition. It's sensing things very differently. I can go into a whole bunch of experiments that I'm doing with large language models. It made me re examine these fundamental questions and then not shy away from bringing that to the fore and talk about human consciousness itself. One of my observations has been that, with machines, humans have lost their motor capabilities, or it's not been the same. Like, we used to be able to walk, climb, move far distances. Obesity was never a problem to begin with, but with machines, all that came to the fore, unintended consequences. With AI, it's going to extend our mental capabilities, but at the same time, because of that, it's also making us lose some of our mental capabilities. And the chief amongst them is, for example, ability to navigate without maps, ability to spell, handwriting, that we all had once upon a time. You could go on. When you put this on an exponential curve and where this might all go, and with convergence and everything, I can very easily see a future not too far, but very easily, even maybe next year, because AI is doubling exponentially every 6 months. So we're talking of double exponentials here. So I can see a future very quickly where AI will very easily displace humans in pretty much every field. It used to be a distant thing even last year, but right now, like, given the things that I've been exposed to, I think we're already here. And someone said just yesterday that as far as him and his AI is concerned, AGI is already here because his AI is already better than him. And I think I can comfortably say that my AI is very easily far more capable than I am in too many fields, and it knows too much. I want to draw back the conversation to something fundamental. It may be philosophical, but I think it's important to talk about it. I see a shrinkage of human consciousness in all of this. Like, so if you take the field of GI, the capabilities of GI are going to shrink because of AI. It's going to extend, but also shrink. So it becomes more and more important to know and explore who we are, because the machine now, or the bot now, seems to know me more than I seem to know myself. And how can that be? Then what happens to the human experience? Let me pause. I would love your reflections at this point, and then we can unpack it further.
Can't argue with any of that. And it does paint a very concerning picture of where we could be headed. You and I are fortunate in a way that we lived most all of our lives without any computer system aiding our intellectual development in the way we're seeing now. We've had computers for a long time, but I never had a computer fill in the next word that I'm thinking before. I had my own computer, had to figure out how to do that. Now, we seem to have figured out how we do that, through large language models and multiplying massive matrices of values, okay, and giving vectors, multidimensional vectors to tokens to words. I mean, whatever those mechanics are, is what we seem to do. But we learn to do that on our own. And now we have kids that will apparently never learn how to even write. I mean, sure, you can write a few words in a row, but why would you do that when you have the world's best writer right there? So, I guess I feel at a huge advantage right now because this is no longer the knowledge economy or the data. This is the wisdom economy now. It's whatever last vestiges that we have as humans to be wise, to be able to be creative and wise in ways that the computer can't yet do. Those are going to be the people who can figure out how to use these technologies and really supercharge them. But I'm worried that, I have kids, that the next generation after them is going to just simply lose that form of consciousness. Like you say, a shrinking of consciousness, a shrinking of capabilities. The lights are still on. I mean, we're all still conscious entities. And it's arguable whether computers are conscious or not. That's another discussion. But the capabilities are definitely shrinking. How is somebody like Einstein going to think about relativity? At the very least, to be able to think about relativity and understand, for that idea to blow into somebody's mind, you certainly, at the very least, need to know what word comes after a word, or how to code, or the equivalent of all that in 1906 or whenever that was. How's that going to happen now? I don't know. It might just be the computers doing it for us. I just don't know. It's scary as hell.
In spiritual circles, or where some of these philosophies are more freely or differently discussed, my reference point is always yoga philosophy, and I'm going to reflect on that, and I'd love your reflections on that. There are two types of knowledge, and one type of knowledge which all of us are familiar with is the knowledge coming from outside. It's outside in. It's, we study, we go to school, we go to college, we read, we interact. So it's given from our senses and it's coming from outside in. But there's a different type of knowledge that's coming from inside out. And this came to mind because you referred to Einstein and Beethoven and like some of these discoveries. That's not exactly coming from outside. It's, these are insights or wisdom or knowledge that's surfacing from inside to out. With this veil thickening because of AI and because of us not being as in tune with ourselves, I see that to be a potentially a very big problem, because this inside knowledge is never going to surface or is going to minimally surface. And not only that, but it's also, we're going to assume that we are very knowledgeable because ChatGPT is telling me what to say, what to do. And it's not just ChatGPT, you take Perplexity. I mean, there are too many AIs that are very, very wise now. And it's giving me so many ideas. It's very easy for me to present and think that that's me. And those are my ideas. I can see I'm almost doing it. I'm talking to people and I can see it's already influenced what I say, what I do, and I'm behaving in that manner. And I'm thinking it's me.
I just had this, as you're talking, crazy thought that I've never thought before, but you just drove me to it. And I don't know if an AI would ever think this thought, and maybe that's the difference between a human and an AI. But there's some theories that life itself may have emerged from like literally crystals at the bottom of the ocean. And these clay crystals had they actually self-form, and they have little imprecise imperfections in them. And then somehow organic molecules found themselves in these niches and ended up slowly taking over the form of the crystal itself. And eventually RNA and DNA and all these things emerged. And then something basically that used the scaffolding of the crystal to form life. And life emerged in the form of, let's say, a sponge, okay, which is almost like filling the crystalline inner surfaces of these things, and then somehow we had life, and then it evolved. I feel almost like we're seeing a reversal from biotic systems to abiotic systems. Like what you're describing is a slow takeover, and that's what this theory is, this biological takeover of inorganic scaffolding. It's like we're putting ourselves back into the scaffolding. We're taking our biological systems and we're slowly replacing them right back into inorganic mineral systems. And we're taking our scaffolding and building systems around it. And it's almost as if we're going from biosis to abiosis. And in the worst dystopian world, this is a mass extinction event. I mean, this is literally us moving into the R2D2s of the world, C3POs, in a crazy reversal. Except we've taken our consciousness and we're embedding it into mineral systems. Those original crystalline forms had very, very little consciousness of any, if any, consciousness. Now we're taking this incredible biotic consciousness that we have evolved over millennia and putting them into mineral forms. That's a ridiculous concept, and I hope it's not true, but I'm kind of thinking that as I'm listening to you. And as I said, I don't know if an AI would come up with this, or if it's just too late for me here and I'm getting a little tired at the end of the day. But that's what you make me think about. It's a bit scary.
So when this interview is going to be out there, anyway, an AI is going to listen and learn and reproduce in some form or fashion.
Take credit for my crazy thought, which I hope is just a wild thought experiment.
Let's agree on what is consciousness. There are many definitions, but I want to know what is your...
I think the most fundamental, let's say, criterion was put out by René Descartes, in the 1640s. And, he famously said, I think, therefore I am. And that's the necessary first requirement, that a conscious system is aware of itself as an entity in the world. Now, it may be real physical entity, it might be an immaterial spiritual entity, who knows what its metaphysics are, but it is a thinking entity and therefore existing. Another way of thinking about it more neurologically is the lights are on. Okay, the lights are on and there is a space for thoughts to exist. And consciousness is the necessary prerequisite for there to be cognitive contents within that space. Now, we can get more and more sophisticated with mathematical models of consciousness or, spiritual. But to me, I think, therefore I am is the first requirement of a conscious entity.
Mm-hmm. Mm-hmm.
You can only know, like Matrix style, I might be in a simulation, I might be in a computer game right now with incredible gameplay, very tough rules in this game, by the way. It's not an easy game to win. Elon Musk seems to be winning it. All right, he's beating everyone else out. That all might be true. I don't know. But at least I know that I think. That's all I can know. I don't think that could be taken away from me because I otherwise wouldn't have been able to think it. That's consciousness.
Okay. As a researcher, scientist, and somebody so actively playing a role in science, do you also have spiritual underpinnings? And does that come to bear? Are these worlds colliding?
Well, it's so interesting. I grew up fairly religious, conservative Jewish household. I was bar mitzvahed. I believed in God. Then I studied philosophy as an undergrad, and that was all. I was disabused of all those notions. The materialistic mindset that we are physical substance and consciousness is an emergent phenomena of neurological, firings, and it's just this incredible emergent experience of qualia in the world overtook my sort of religiosity, and I was an atheist, maybe agnostic at best. Since that time, I've come to realize that I can't know anything for sure other than I am. So I really can't be atheistic, but I'm willing to accept sort of agnosticism. But as I think more about these deep problems and as I get older, and there's the ever-present, question of who created the simulation, such as it is, it's hard not to wonder there's a spiritual purpose because it does seem like there's a directionality, and that directionality is evolution. And what evolution has given us, it gives such power that maybe a clay crystal can give rise to a sponge, can give rise to dinosaurs, or humans. So evolution means we want to stay alive. And there is some directionality. And why do we want to stay alive? I don't know. Almost as if we've been imbued with a determination to impact our world and stay alive within it. And that feels like a mission from a possible creator. But I don't know a damn thing.
It's amazing. I'd love to riff on this topic forever. I want to draw our conversation back to medicine. What does all this mean for a kind of medicine that's going to evolve from this point on? Will doctors be as relevant, let's say, 5, 10 years from now? Would that shift? What does it mean for gastroenterology? A lot of people listening would be gastroenterologists, so I like to.
If they're still hanging in there, that's impressive.
That's
scared them away with the mineral, the analogy of. Well, I will transition from our crazy conversation back to medicine. I will say, again, if you play this mind experiment about this being a simulation, which again, actually, there's reasonable evidence, or at least philosophical arguments behind. Maybe medicine then is really just about fixing the bugs in the code through something literal like CRISPR. I mean, that's literally fixing bugs in the code. What is VR doing to somebody? How is VR resetting somebody so they don't feel as much pain? I don't know. Is this working on a quantum level? Like, I don't really even know. Is it fixing the bugs in the code? And that's what gives rise to illness and disease. But if we get to ground level now, back to Earth again, what this means, though, is I think AI is going to demand of doctors to be the best doctors they possibly can be. It's not going to be who knows the most anymore, because the AI will know more than us always. It's going to be about who's the best communicator. Can we do better than the computers? Can we be more empathic than the computers? Can we do a better physical examination? Actually lay hands on and do, exams? Can we look people in the eyes in a way that still leverages the human touch? Can we do procedures that robots don't yet do? Now, again, every one of these things might be replaceable. But until that time, it's going to force us to be the best versions of ourselves that we can possibly be. And that's why we went into medicine. It was to take care of patients. It was to look at patients in the eyes and to communicate, share decision making, to share the wisdom, not just the knowledge, to do the procedures, do the exams. That's why we went into medicine, not to fill out insurance forms. I mean, not to write notes. So I didn't go to medicine to write notes. That's the stuff AI should be doing. We have to then figure out whether and how we can possibly regulate it so it doesn't take over all the rest of humanity. That may not be possible. But until that time, that's what I think it means to be a doctor right now.
That's such an amazing response. Wow. My final question to you, what advice do you have for people listening, and likely the physicians or in healthcare for sure? What can they do to stay relevant in the age of AI?
Well, there's a saying, I didn't make it up. AI will not replace doctors, but doctors who use AI will replace doctors who don't. Now, time will tell if that's even true, because AI might replace the doctors too. The same could be said for any profession. So right now, in this moment in time, before AI has taken over all of civilization and we've lost, we've had a mass extinction event and these horrible futures, we're not there. We're right now. You have to figure out how to use AI. You have to figure out how to use technology. The way we learned in medical school is just not the same anymore. I mean, we still need to know these things. We still need to know how the body works and diseases and be able to diagnose things. Just last week, I diagnosed Ehlers-Danlos syndrome, a relatively rare condition, literally by shaking somebody's hand. I felt their wrist crack in a way that was unusual, and I know that that can happen with this disease, and I know that that disease can mimic irritable bowel syndrome, and we diagnosed her. AI cannot do that yet. AI does not shake people's hands and measure cracks in the wrist. So we are going to still be different from the AI, but we have to use AI to distinguish ourselves. Think about whether you want to start using virtual reality in your clinic, for example. No one else is doing it. Why don't you do it? Think about how to use AI in a way that makes you closer to your patients, not farther, so you can spend more time working at the top of your license, talking to people and getting better and better at those things that led us to be doctors in the first place. I mean, I think those are the pragmatic, answers rather than these philosophical side trips. I think those are the real pragmatic answers to your question right now.
Any final reflections, Brennan?
Well, I'm afraid to reflect too much more because I've already gone off the deep end a few times during this conversation. So no, we've covered a lot of ground, and I think it was really a pleasure, going through this with you.
Yeah, no, thank you. I truly enjoyed it and quite fascinating. Thank you so much for playing with me.
Thank you. Thanks for having me.